What do you do if you're exposed to a bloodborne pathogen or have a sharps injury on the job? Let's look at the best recommendations. For all exposures to any type of bloodborne pathogen, you should do some basic first aid. You should first encourage bleeding. This will help to eliminate some of the pathogens that may find their way into your body. You should wash the affected area with soap and water. Do not scrub the area or use antiseptics, as they can create microdamage to the skin, which will allow entry for pathogens into the skin. Wash your hands and remove contacts if the fluid was in contact with your eyes. Flush out your eyes. Cover and protect any open skin with impermeable dressing and keep clean. The next step is to evaluate the level of exposure so you know what to do next. Risk levels are categorized as minimal, low, or high. For an exposure to be minimal risk, it usually means the skin was not breached, there was no needle used on the patient, or the exposure involved low-risk fluids like urine, feces, saliva, or vomit. A low-risk exposure might include an injury through the superficial layer of the skin, use of a needle in a non-vascular procedure like suturing, or something that only went into the subcutaneous layer, exposure from old or previously used sharps, or a sharp that had no visible blood on it. High-risk exposure includes sharps injuries that go deep beyond the subcutaneous layer, use of a needle in an intravascular procedure like an IV or blood draw, recent use of the needle without time for drying, or if there is visible blood on the sharp. So what do you do if you have exposure to a bloodborne pathogen? First, always follow the basic first aid steps. Wash the area, cover wounds, and flush mucous membranes if needed. If the exposure is minimal, no further action is usually needed. If the exposure falls into the low or high risk category, the next step is to evaluate the fluid and the patient involved. Ask yourself whether the patient is known to have a bloodborne pathogen disease. If not, are they involved in high-risk activities such as repeated needle use or unprotected sex with multiple partners? If they are negative for bloodborne pathogens and not considered high risk, then no follow-up is needed. However, if the patient is known to have a bloodborne pathogen, or if their status is unknown or they do not consent to testing, then post-exposure prophylaxis or PEP treatment will likely be required. Post-exposure prophylaxis, also called PEP, is a treatment that helps reduce the risk of getting a bloodborne disease after an exposure. It is used when there has been a significant exposure to blood or other potentially infectious materials, and the source is known or suspected to carry a disease like HIV or hepatitis B. Timing is important. PEP should be started as soon as possible, ideally within 1 to 2 hours after the exposure. Waiting more than 72 hours greatly reduces how well it works. If you are exposed and fall into a high-risk category, or if the patient's status is unknown and they cannot be tested, you need to report the exposure immediately. This is not something to wait on or keep to yourself. Reporting helps start the evaluation process right away so you can get the care you need. If you are prescribed PEP, you will usually be given a 28-day course of antiviral medications. These need to be taken exactly as directed and not skipped. During this time, you may also be monitored with follow-up blood work to check for signs of infection and to make sure the medications are working. Some people experience side effects like nausea or fatigue, but it is important to stick with the treatment unless told otherwise by a healthcare provider. Remember that PEP is not a cure, and it is not guaranteed to prevent infection, but it is the best tool we have to lower the risk after exposure. The key is quick action, honest reporting, and following through with the full course of treatment. The sooner it starts, the better it works. Let's take a look at a chart of how effective each of the types of workplace practices is. As you can see, elimination of the procedure is the most effective, followed by engineering controls, then administrative and workplace controls. Next effective is PPE, which has low effectiveness, and last would be post-exposure management.